Hi everyone, it's Jeff Pierce from Michigan Sports and Spine. This is week 3 or 4. Anyhow, I welcome everybody. We're doing this Facebook Live. We are gaining momentum, we're getting more followers, and we're also getting a lot more questions. We've been doing this telemedicine thing. We're doing the Facebook Live thing. We're becoming social gurus. But to be honest, I've made fun of this stuff for years and I was resistant, but we really are touching people, which I really want to kind of capture at the beginning here because I've been able to be very productive. And you're seeing a lot of commercials, you're seeing a lot of people doing it, and we keep pushing what is the new norm. And this is becoming the new norm. If we can solve patients' issues in a more efficient way, where they're not coming in, going through, we got to go through referrals. We need to go through the hassles of getting a referral from the doctor and all this, waiting in the waiting room, waiting for the doctors. There's really been a lot of positives coming out of this. And it doesn't mean that we don't want to see you in the office, but we're able to accommodate things in a convenient way. And I think we're starting to realize the efficiencies of telemedicine. That I started telemedicine years ago, and it was really pushed back because of the insurances that they felt it wasn't efficient. Now, I'm always going to be on the side of it's always better to especially for my specialty, I need to examine you. I need to get my hands on you to tell you what's going on. But for a lot of the patients that we've seen, we're able to solve their problems in a more efficient way. So it's been useful for some, and what we're doing is we're really finding what we can handle in telemedicine and what needs to come in. And that's my challenge, and that's what I've been doing over the last 3 weeks now that we've opened. And we are seeing patients based mostly on emergency-based situations before anything else. So we are bringing patients in. Last time we did say what is our new norm. And our new norm is, like I said, we're bringing patients in more about emergency basis. Jules just walked in,
we have a special guest.
She's going to be our special guest here in a second.
So
But basically, the new norm is, you need to be checked. There's nobody really in the waiting room. Maybe one person might be in the waiting room. We're checking temperatures. We're doing all the CDC guidelines. We're wiping down everything. And I was late yesterday because we actually had a busy day with seeing patients. It is taking longer. So we're spreading the patients out a little bit more. We're seeing people, and it's a little bit harder wearing a mask and gloves and gloving up and cleansing. So you need, you're not going to see the doctor, every 15 minutes or every 20 minutes or what we used to do. It's a longer time. So that can be a positive too. We're going to spend a little bit more time, but half the time you can't hear exactly what they're saying. I fortunately read a lot of people's facial expressions where that's being hindered with the mask. So it does need to have more conversation. Like if you're grimacing or I put you in a position that hurts, sometimes people are like, there's not an issue. Some people over exaggerate, but we're not able to have that factor right now. We've lost that factor. So when we say we're open, we're definitely open. We're seeing patients every week. We're doing our injections every week. But again, we're prioritizing for the patients that are having more emergencies or more issues, and the patients that aren't, we're still seeing them by the telemedicine. So Jules is coming in here. So you have to excuse, she said that everyone who's in our practice are people that she's fixing her hair. They can see you.
I know they can.
So we are the team that's pretty much been put together, and hopefully we're solving. We've got the other big thing is we've really pushed a lot for surveys. We want your feedback, and I proudly admit that there's a lot of positive feedback coming in, both on our Facebook surveys and all the surveys, and our marketing team and Nicole's who set this up is really we're working hard to get to your feedback, where we're doing well, where we're not doing well. We can't upset everybody. I've actually gone out and I've been told not to. We're going to do the best we can. Jules is kicking butt, as she says today. Are you going to say anything?
I'm trying to, at least. Yeah. Yeah, but we're just doing the best that we can every day.
And with the new norm of the office?
Yeah, it's different, but it's good. We're being very productive. But we missed everybody. We missed everybody's faces and getting to see people in person. But hopefully in the next couple weeks or the month, we'll be able to see everybody again with their masks on, of course. Even though we don't have it on right now.
That's right. Well, we have them here.
Yeah, we have them here. They're in the office, but
We have cool.
Yeah,
My
very
son
cool.
thinks they're very cool, so he has one now
We
too.
look like birds. Okay, I'm out of here. Bye, guys.
All right, so that's our new norm. We haven't changed. You still have, Jules taking all the information, myself. And we're doing the best we can. Everything's kind of getting back to normal, which is nice. Or the new normal. Like I said, everything's taking a little bit longer, but I think we'll get our rhythm with that also. So we are open again. Just to summarize, we're open for the telemedicine. We're in office. We're doing injections. I'm bringing people that need shoulder injections, hip injections, any type of joint injections. We're bringing to the office. We're going to start doing our musculoskeletal ultrasound again. We're obviously doing nerve tests. So everything is being productive from that way. We're getting to return to work. So like everybody that I'm talking to, for some reason this week, the 18th was a big day. A lot of my patients are back to work, and they are running into the problems that we talked about, and that is the conditioning of work. You can't sit down and expect to go back to full duty. And I mentioned it last week that it's not just full duty, it's limited employees are coming back, so that means they're working longer, you're working harder, so your risk of injury is even higher. So you have to take that into account. If this is happening to you, then you need to get in. We need to get you in. If friends, we're encouraging everybody to obviously watch this, but also to encourage your friends. Again, it's a 2-week rule. If you injured yourself or work is just overtaxing you and you're being injured, if it's lasting 1 to 2 weeks, then you need to get in. So another question that comes to us is, I started running when my gym closed. I consider myself pretty active and fit, but I definitely feel it's taking a toll on my knees. What should I be looking out for to prevent further injuries myself? So the knees obviously are going to take a large pounding. If you're starting to run, it's an impact sport. A lot of times with patients that have neck pain or back pain, I try to eliminate as much impact as possible because of the forces going through your knees. If you're not used to running and that's something you just started, the knee injuries and the hip injuries and the ankle injuries are increasing exponentially. I talked about shoe wear last week. Again, shoe wear is majorly important. The prevention, a lot of times people are like, okay, I got 20 minutes, I'm going to go run. You need more than 20 minutes to run. You need a warm-up, a dynamic warm-up, a proper cool down after. That's including the run. Sometimes I'm asking people if it's a walk or a run, to go, like if you normally are running, let's call it 30 minutes. You may want to stop at 15 and stretch out if you do have a back injury. So you can do like a dynamic stretching routine for your back or your neck at that point. To just worry about your knees itself, you got to worry about the surfaces you're running on. You have to run on a softer surface. People are out there running on cement and asphalt. Asphalt gives a little bit more. Cement doesn't give it all. You're feeling all that impact. With newer type of shoes, we've been able to correct some of that impact issues. But again, they need to be new pair of shoes. Usually 200 miles on a pair of shoes is when you start thinking about changing them. If you're not aware of that, then you may be wearing a pair of shoes that aren't right for you. And then running shoes, like you go into any type of Nike, Dunham's, Dick's, there's the running shoes, the training shoes, all that. They do make a difference. There is making a difference as far as the cushion in the sole and the way it absorbs and energy absorption. It does make a difference for your knees. If you are having knee pain, ice is always the first line. Ice, rest, and elevate. If it gets swollen, swelling of the knee is a big deal. It's telling you that there's an indication that there is a further injury. Swelling that lasts more than a day is definitely something that you need to be coming and be seen. That's not just going to go away, especially if it's new. If you feel swelling and pain, that's definitely an indicator. You can't really blow that off. That needs to be seen right away. If you're just having soreness and issues and things like that, ice, sports creams to the area, elevation, and range of motion. The best thing for your knees is always to have a good strength in your upper leg, between your hip and your knee on the front, the quadriceps. The hamstrings are also important to do, to keep an eye on. Hamstring stretches are very important to prevent injuries, especially for gastrocs. Also, your calf muscles, you need to stretch those out. So if you're gonna run, I would put a timer on and do the stretches for no less than 5 minutes, ideally 15, but no less than 5 minutes you want to stretch. When you're done running, you also want to do a cool down. You want to maybe walk it out, do a dynamic cool down. And like I said, if it's painful, you want to ice for sure. You ice initially, and then the sports creams are important too. If it's radiating pain, that's a whole different indicator. That can be coming from your back, or you have nerve issues. But usually you do not have radiating pain. It can just be joint pain if it's truly related to the running. Another question that comes in is, what is the best position to sleep when you wake up in the morning, your back is not hurting? So there's a bunch of things going on. If you're watching any commercials, which a lot of us has been watching more TV, there's the Sleep Number bed, there's the purple mattress. All those things play a role. A poorly supported mattress will lead to further issues with your back. There's something called the body pillow. A lot of times I tell people to put a pillow between their legs, because what that does, it changes the forces on your back. So if you have a wider pelvis, I'll just use my hands, but if you're a wider pelvis and you're laying that side lying, you're creating a torquing position on the side that's up. So if you're laying on your left side and your right side is up, you're going to have an extra pulling on the force on the right side. So you want to kind of put a pillow in the middle of your legs so it levels out your pelvis. So you're in a more of a neutral position. So you won't create that pulling on the nerves and the foramen, or the openings where the nerve is. So that becomes a big issue. So number one is you want to have a good supportive bed. The sleep numbers, not everybody can afford something like that. A good supportive bed is a firm mattress with a small cushion on top. You want a small supportive cushions. Tempur-Pedics, I'm not going to comment on. I'm not a fan of them, but some people are. I feel that you need that support. You don't need to have your body positioned in there. So it depends on who you are. There's evaluations of sleep that you can do also. But the best thing to do if you do have pain in the morning is take no less than 20 minutes of stretching in the evening before you go to sleep. So the more flexibility you have, the better you are at sleeping. So it's very important to, number one, do stretching throughout the day. And then if you're having troubles through the evening, is 20 minutes of stretching before you go to sleep. And actually when you wake up, you don't just pop out of bed. You roll side to side, you stretch your hamstrings, you stretch your extensors of your back. We have a very extensive program that we do just for the mornings. So it's the exercise before you go to sleep and when you wake up. And obviously if you're still having issues, you want to walk around slowly, and potentially, most people get in the shower right away, get in the shower and do another set of stretches. So this will hopefully help you in that position. If you feel you're doing all those things, that might be another reason that you need to be evaluated and seen, because the simple stuff will resolve. If it's still having difficulty in the morning, then that's something that needs to be evaluated sooner than later. So the last question is, what else do you treat? Pretty general for one of our patients. A lot of people think, initially I treat just professional athletes. That's not true. I treat everybody. The thing is that we coined is that we treat everyone like they're an athlete. Because of us dealing with the highest level athletes, I always say we need to have you ready by Sunday. It's the same attitude we take with basically neck injuries, back injuries, but we also do every joint. We do almost everything that's not surgical. So I just told the patient yesterday, we're here to keep you from surgery, but I'm not going to keep you from surgery if that's truly what you need. And it's been fortunate of my practice over the years that I'd be able to work with some of the best doctors in all professions throughout the city, and we do have special ways of getting you in a quicker time frame if it's needed. So pretty much we take care of everything from a non-surgical standpoint. We can evaluate you for surgery and get you to the proper surgeon. that I feel will fit your needs. And it's not just sports and spine. It's not just a sports injury. We label sports injuries, but some people have told me that's a little bit misleading. And we take care of every type of injury. If you fall at home, if you've lifted your child, if you were combing your hair and someone startled you, we created the neck pain or the mid back pain. Those are all things that we take care of. We take care of wrist injuries, elbow injuries, and shoulder injuries. We pretty much, over the years, we've specialized in neck and spine injuries and low back injuries, but we are focused also on all types of non-surgical injuries that we've been very successful in treating. I just had one of my high-end athletes come back after 12 years, which I can't believe because we both had little kids, and now we're talking about graduation of high school and going to college. So he came back, he was golfing and kind of overdid it. He played 27 holes and he just overdid it and tweaked his back. Well, he's being very proactive because he had that, where it almost ended his career in the NHL, and he just wants to be very proactive. So that's really the message, even at the highest level, that you have to be proactive. If you feel like we educated him where it's a little bit of, the simple stuff will resolve in 2 weeks, but this has been going on for 6 weeks, and he's finally had to get in. He's a little concerned about the COVID, so that delayed it. But normally, if something's bothering you for more than 2 weeks, you definitely need to get in. Even at, this guy's still a lead athlete, works out on a daily basis, but what came down to it is that he was working out the wrong parts of his body, or not the wrong parts, but he was neglecting the hard stuff. And that's what we're all guilty of. And I'm guilty of that also, is that especially with the core muscles, if we just take your low back, you have to work the muscles that are hard. It's the core muscles. I tell everybody, it's the muscles from your belly button down to your pubic bone, both in your front, your back, and your rotator muscles. That's really the hard part of the core that people neglect, and they tell me they work their core all the time, and then I'll go and evaluate, and they've been not cheating, but just working around it. Especially if you have large muscles in your chest and your legs and your glutes, you actually create a muscle imbalance. So with that, we're looking to get more of your feedback on a daily basis. The social media is putting me more in touch with patients, and actually not just patients in Michigan, but we're getting patients from outside. We get a lot of good questions coming in, but it's challenging me, which I need, on their issues, and be able to communicate better. And I want to be able to communicate your needs and make sure we're resolving what's on your mind, not necessarily what I want to spit out. So again, I encourage you to message us, let us know how we're doing, and if you like this platform. And also, like I said, we've been on 97.1 The Ticket. We did this Facebook Live then. So now being able to do it in the comforts of our office, I think we're going to start getting, Jules was our first guest today, but I think we're going to get Dana in and some of the other people that used to be on the radio show. So give us your feedback. Let me know. If this is not interesting, let me know that too, and we'll try to be more creative. But peace out. We'll see you next week, Wednesday at 3:30, and pass it on to all your friends. Thanks.